We have an interesting slide here also. This patient showed up today, and you can see the tremendous numbers of spirochetes in this patient's mouth. Of interest also in this mouth are trichomonads, which they have a peculiar kind of motion. And there's lots of polymorphonuclear leukocytes in this particular slide. Over in here we have just a tremendous number of spirochetes. Most of these things, as I focus up and down, it becomes pretty clear what they are. Lots of different sizes and different kinds, maybe as many as 40 or 50 different kinds of spirochetes on a slide like this. And who knows what all of them are, but we know that they're an extremely active cell, tremendously motile, and tremendously aggressive. And as we move through these cells, and we see up at the top of the screen here, we're going to be looking at lots of spirochetes up in here. These guys, most of us don't get a chance to see this unless you spend the money for one of these microscopes. But if you do, you suddenly begin to realize toothpaste. This is the results of toothpaste. This is somebody who brushed their mouth 3 times a day with toothpaste. And I think pretty clear that it's pretty much a mess. However, 3 days on baking soda in this case is going to be, there won't be one living thing alive in this mouth. Every one of these animals will be dead and gone. We can Clorox bleach in the Dakin solution that will bring it out of the patient. Will be, they'll be gone. There won't be any more spirochetes in their mouth. There won't be anything else. And the difference is that when you quit using toothpaste, which does nothing, and start using things that kill bacteria, such as Dakin's and baking soda, you're going to see a vastly different situation. Right in the center here is a nice red blood cell. That's 7 microns, 7 millionths of an inch across. So it gives you a very good way to tell the size of some of the spirochetes that are around it. This red blood cell, with phase contrast microscopy, this stuff is visible, whereas without it, it isn't. There's some huge spirochetes in this particular slide, and some odds and ends of other things in here. If you focus up and down, you get to see other items going on. Here at the top of the screen is a polymorphonuclear leukocyte with lots and lots of spirochetes around it, and you can see the tremendous cellular activity, nice live cell doing fine. Some of the others down here, like this one down here, this guy's dead. See nothing in there. But these kind of cells, we later see that they become infested with bacteria. Bacteria invade these cells and get inside the cell wall, and they can't get out. It's really quite interesting. Here's another wonderful little guy we see in here. Just a tremendously active little guy. This kind of activity, and really quite intriguing. I never cease to be amazed at what we can pick up with our phase contrast microscopy working with these patients. Up here at the top of the screen, you can see the numbers of spirochetes in here. Large numbers of spirochetes. Some really big, ugly ones that are very, very thick. Some very long, thin ones. Some of the very, very tiny ones, they don't show up so well, even at 1200 power. So, and this is a 400 power objective lens, but when coupled with the video amplification, we get up to about 1200 power. And you can see the size of the red blood cell here and how big and wonderful it is. Looking at that thing, and then on over we have a PMN that's dead. This is one of the kinds of cells that we see with bacteria entrapped inside of them, and you can see the tremendous number of large spirochetes around it. There's a very long one here, probably a good 15, 16 micron long spirochete here. And you can see the tremendous activity these guys have. Just an amazing, amazing thing. Right next to that PMN, there's a huge long spirochete here. And then you see other types.